Hi, in this video I will teach you how the NCLEX is scored, the psychology behind NCLEX question. I will also show you the NCLEX study guide provided even from the actual testing center. I will also show you each chapter. I have my textbook from my college. It's Davies, but I think every college has great textbooks and all of them connects with those NCLEX domains. Just follow your college textbook. We have a lot to cover. Give me a few minutes to show you all of this. Hey everyone, I'm Nurse Mia in Continuing Education in Nursing. In today's episode, I want to talk to you about something that could truly change how you study, especially if you are overwhelmed, short on time, or unsure where to begin. Question for you: how you learn smarter, not harder? I will share my successful formula that helped me to pass my NCLEX PN, the LVN, with 87 questions for my first try. And English is not my first language, not even the second. First, in a perfect world, nursing students will have time to sit down and fully read every chapter before class. But let's be honest, 5 to 8 chapters per week, a commute, maybe work, family, is nearly impossible. I've been there. I commuted almost 3 hours a day, 5 days a week for 18 weeks straight. And even with all my passion and planning, I failed one class. But not because I didn't understand the material, but because I had no time to fully absorb it. This setback was kind of a plot twist planned by the universe. And without it, I wouldn't have time to create and publish my story, my way I study, the study guide materials I do that made me successful. I just won't. And I will just move on with my life, and there you go. So me. But we all know real growth doesn't happen when things go easy. It happens when you get knocked down and still say, nope, I'm getting back up. That's why I started creating those YouTube videos to make it easier for you to prep ahead without feeling like you are drowning. My formula, I always say, it's quite simple. Each chapter is broken in 3 parts. Each video is under 25 minutes. I try under 25 minutes or less. Why? Because science shows we retain more in short bursts. After 20 to 25 minutes, your brain gets saturated, and quick break helps you reset your focus, and that's the exact psychology the NCLEX it's built on. Critical thinking in time intervals. So those videos are while a student walking to class, folding laundry, walking the dog, if you have one, earplugs, and you listen while you're doing groceries and other stuff. In addition, a student who didn't have time to pre-read but wants a preview, like you go tomorrow to school and you think, oh, what is the chapter about? For a student retaining retaking the NCLEX who wants to master the 15 domains but doesn't want to bounce between 10 different resources. And the truth is, you don't need to study from everywhere. Just stick, and it's better to understand your college textbook, especially like I have Davies edition 3, but maybe next year will be 4, 5, etc. Just follow your college textbook because each of them is directly aligned with NCLEX test plans. Second, let me show you something important. I will share my screen now. Give me a second. Struggling students, here are some stories about some nursing students. As you see, this was a platform of Facebook, and this student says like, I just failed my NCLEX LPN PN, which is the LVN, the 5th attempt. I'm at loss for words. So these are like places like people jumps and start studying, which is, it's okay, but looks like I feel I'm studying habits aren't 100%, more like 75. So it's not fully engaged, even has like 2 or more platforms. So I listen to NCLEX Crusade. So much more like it's back and forth, and other persons are like 4 attempts. Again, everybody has a lot of opinion and back and forward. But I want to show you more. Like another person says like, this is my CPR report after failing on June the 30th, which today it's close to end of July 2025. So it's about a month ago, and I test again for my second attempt on August the 29th. So it means like another month from now. Looking to push the date to August 16 if there are any availability. So I just received a job offer based on my passing, and it's a dream offer. So here shows where NCLEX give you why is the reason that student didn't pass. So zooming in, if you see here management of care near the passing, again safety and infection control near the passing below psychosocial, right? Near, above, grade, below, near, above. So basically 3 of them, they are okay, but the rest, it's like not that great. Again, another example. Hi, recommendation please. So you can see a day ago, and this kind of make me to push to record this. It's my second fail, and again this person CPR say like near, below, near, above, near, above, near, above. So if you see that one is critical, basic care and comfort provides comfort and assistance in the performance of activity of daily living. ADL, provide comfort. So this is like probably delegation between a CNA to LVN close to RN, but RN does provide all this care, right? So how the NCLEX works, how it does. Is there a psychology of being tested? Yes, it is, and it's provided even from the test center. Many are not reading it. So here is the NCLEX center, right? So it says about prepare, register, exam day, everything, NCLEX. What is the test plan? Candidates are encouraged to review the NCLEX test plans before their exam appointment. The test plans contain in-depth information regarding exam content, exam administration, item writing tips, and the inclusion of clinical judgment. The test plans guide candidates preparing for the exam, inform the direction for item development, and facilitate classification of exam items. The test plans are updated every 3 years to reflect fair, comprehensive current entry-level nursing competency measurement. Okay, so if we do RN, you just press a download and I will show you what this shows. And for the LVN, it's same, just a little bit different than RN. In the past I did this, so for me I did not this test, but before that, because mine was with 19, early in the 19 I passed it, so so now I'm in here. But it says effective April 2023 through March 31st, 2026. So today we're in July, end of July 2025, which is approximately a little bit more than half more year until it's changed everything. So here are more in detail from that booklet, and says distribution of content. Let me get my highlight. Distribution of content, and here it says percentage. Let's say you aim for 100 questions to pass the NCLEX. Imagine, like, to create this pie you need 21 questions from here, 16, 12, 12, 12. Look how much you have to answer, and you feel like it's never going to finish. So then this is a short screen from another page from that booklet about safety and infection control. So look here, like another, like close to 20 questions. Imagine you have a quiz of 10 questions, but you have to do it twice, like 2 times more. So safety and infection control, and these, they're related from 2021, but it's kind of the same that is going to ask you. So assess the client for allergies and intervene as needed. Okay, what do we know about allergies? Can be food allergies, can be all kind of, like, even medication. When you go and see the MAR, you see, I saw nurses that look for medication first, and if he sees diet or certain food, they just, oh, it's not the medication, so I can give the medication, you know. So, but they forget that maybe later on the day, caregiver or somebody says, like, oh, I can give a peanut butter sandwich, or maybe Prexel that has peanut butter inside, and the patient basically really has peanut butter allergies. You know, so how you intervene, you need to know what kind of allergies. So these are kind of little examples that might show up in the case study. Like, even a case study might show up saying, like, oh, this person comes in emergency room with a swollen face, so it's signs of symptoms, right? And then it's redness, it's itching, and cannot breathe, and all kind of. So how you intervene, how you do it, how you assess the client. So what else we can say? assess client care environment, like how about the narcotics, how you intervene when the caregiver transfer a patient without a gait belt. What else? When escalate concern if staff comes to work intoxicated. Oh yes, yes, I've been seeing those questions, right? I hope so. How about, let's see. I like the one with restraints. People, they don't think much about restraints. So when I was an LVN, I will print this booklet, even if it's like about 60 pages, but if you put back and forth, it's like 30. And then I was just writing down here, like examples. Okay, allergies. What do I know about the allergies? How I interview about this? And then I would just write here, bullet points, whatever it comes in my mind. I don't need to search like I need hand for this, I need hand for this. No, just like kind of pop-up quiz for me. And then even here requirements when using restraints. It's very important. Like the MD has to do the order every day, and you need to provide within an hour. And then what else we do for it? We monitor for circulation and skin, the restraint. Oh, I remember restraint. So one example, during my clinical time when I was an LVN, we had like a trachea like patients. So I think we had like 6 of them. And then the nurse gave us a pop quiz and said, okay, I give you 3 seconds to tell me about this patient. So one was that if I noticed something. So one of the correct answers were the gloves. So why the patient in trachea had the gloves? It's a restraint? Kinda, because it's a glove. You have a glove in you. But why? Because if it's itching or something, will damage the trachea area. So keep in mind about that. Comment if you have something else better. Okay, you need to restrain as soon as the client is calm and safe. Again, because we're about safety and infection. COVID is another one. Participate in emergency planning and response. COVID, because we were in COVID. And what else? Like, oh, here. We had to do, even as an RN student at the clinical side, we had to do in-service for the biohazard materials and everything for trash. They will check the nurse's trash and they will see which nurse did something wrong. So the hospital was very, very, like, it's like no mistake, 0 mistakes. So they put even the students to do this in service about how you handling. And usually I think in NCLEX they will show like with the needles, because needles, if you don't, the Sharpies, if you don't put it in the sharp containers, like even with home health, you do you need a Sharpies for diabetic. How you teach a patient for safety, for like your patient has this chronic disease, diabetics, and now how you teach. So it's like, I don't have money for this fancy Sharpie thing. What do you do? So what I learned in my LVN times, that it was a question, a practice question at that time was for, you can use the laundry detergent container. Like there are ton up there of detergent, and they say the material, that plastic, it's so hard that it's same safety as the Sharpies, which is better than having put it in the trash. So you see, client on safety issues, boom, like 2 in 1, like, okay, escalate, we talked about it. Oh, we can talk this, I think, for like hours. I'm gonna stop here, I don't want to get you bored, but for some students that are struggling, this will be a good idea to just make your pop-up quiz and see what area you are weak. Just pop-up quiz. It's no good and wrong, or just keep going. And there are many, as you see, there are many. So I'm just stop here. And here the new generation one, the simple pack. They have a lot of examples. You're gonna have it down below, or you can just go to their website and download it, but you can download it down below, it's down there. And these are, look how many pages, 148. So you have a ton of how is going the exam preview, like how the exam is going to be like. And it was fresh, it's very fresh. And here, like, some take action, prioritize, recognize cues. And actually this is a preview from that booklet, and then give you example of each of this. Give you an example of question, what means, and you will understand what means recognizes cues, analyze, generate solution. So there are many. I just short screen a little bit. And here it says like case study. Oh, sepsis. Oh, we were talking about the infection and now it's infection. Okay, the nurse in the emergency department. Oh my God, look, the short screen is like, okay, so select the 4 client findings in immediate follow-up. Okay, what do we have? Let me get the highlight. Madam, client ED, due to increase. Okay. So this morning has short of breath, increased. Okay. Then has running fever for the past few days. So for few, cough up, greenish. Already you know. Okay, short of breath. Fever doesn't go away. Cough. Okay, so the patient kind of struggled for a couple of days and finally decided to come. Okay, 6 days. Vital signs. Pulse ox. Okay, here. It's a lot of going on with this person, right? Skin intake, cool. Oh, wow, cool. So basically, has fever and it has cool to touch. This is okay. So it's alert oriented to place and time, okay. But the adult child states, so the child says, sometimes it seems like my parent is confused. Sometimes. So something is going on for a couple of days. Peripheral. Wow, you see how many already. So it says here 4. Immediate. I don't know. If I have 3 things to say, like 4. Vital signs, lungs, capillary refill not, client yet. I need to think about it. Yes, because it says here like already they put characteristics of cough. So maybe this. So you see, I have to think about this too. But even, let's say, even if I mistake one, or even I say like, no, I don't want to take, and I give you just these three, and I move on. I even don't remember it's 4, but I put 3 instead of 4 for many reasons. And then if these they're correct, then I get 3 points instead of 4. So here you go. Then it's good. So you need, then you go screen 6 of 1 of 6. So this case study has 6 questions based on this characteristic of the patient. So I take my gamma away. So here it says NCLEX-RN preview. This is a different about AKG. So same. So basically you go and you just have so many question examples that you can go, and so it's there on NCLEX-RN formula that works. I think I summarized it, and I think it was helpful to see that if you did not know, but that was provided from the test center and explains exactly how is the structure of the test. And I think every student has a lot of info. You guys passed the classes and the quizzes. You have a lot of and a ton of experience and a ton of knowledge. It's just you need to learn the way the test center is giving to you. And in those packages, they give you an example of how they ask you, and you just, before you go into the test center, as they mentioned that too, you just print out the booklet and pop up your own quiz. I hope you can find a study guide person and you guys can work together. So I just summarized, and so my way is like to focus one chapter at a time, and for each chapter I will provide most of them with the domains and practice like this. I think it's a guarantee of passing NCLEX. And why? Because this way I use for my LVN, and I pass with 87 questions, like literally. And I pop up my quiz, I pop up my own self quiz. I study alone. I had here and there a study buddy, but I study alone, and it helped me this. I knew this for a long time ago. It's just a way of how a question is created. So you need to know the psychology behind it, because even a teacher, if you have like 3 or 4 instructors, everybody's different. Even in the modules, the way they present, the way is giving the lecture, the PowerPoints, the coloring they use, the picture they use, anything which is helpful, because you create your own critical thinking, but to have knowledge about how it's tested for this NCLEX, you need to know their psychology behind. And I think this package is the really the formula. And here, like, I give an example. I created on the video for chapter 3 for review for NCLEX. You see, like, psychosocial safety and infection control. So here, select appropriate pain scale for nonverbal cues. judging pain level. Might be in the NCLEX, might be not. But since we kind of have chapter 3 about cultural consideration, it's all about cultural bias and the LGBTQIA. Same, like room assignments, pap smear, you see, like all kind of, might be, so you never know. You see, implicit versus explicit bias. So all those key terms is in different part. I divide each chapter in 3, right? One is for part 1 is keywords, like, okay, I don't remember what means this. So you go back and review. And if you know, but oh, I need more practice, then you go part 3, which is for NCLEX. And then, I don't know much about this cultural consideration thing. So let's see what's going on, so that I will provide the outline for, that will be part 2. So now to recap, look out for freebies into down below. So let's make a short little summaries. We post the NCLEX from 2025 from Facebook group, students that are begging for structure, for 3 tips, not trips, tips for strategy, and some are on their 2nd, 3rd, 5th attempt. That breaks my heart, because I know how it feels like to try your hardest and still fell short. Not because you are not smart, but because you didn't have the right tools at the right time. I graduated valedictorian for my LVN program, and I also was in honor society at Santa Barbara City College. My classmate always told me, Mia, the way you explain things, why you don't teach? So this I'm doing now on YouTube. So my plan is always, I say it's simple, I create playlist for each chapter. At the end of each chapter, which has 3 parts, I will get on the part 3 10-15 questions that match with this structure that we saw the domains from NCLEX, and the priority, select or apply, and the new gen case studies. You will learn to recognize the cues, prioritize, and evaluate. All those things our test wants you to do. So here is my simple plan that I recap. Watch part 1 for each chapter a day before or while you're driving to your class or the morning routine. Watch part 2 the same, like the night before, or same while you're driving to school, college. Watch part 3 after class. Part 3 is the question practice and then NCLEX style, or just in the weekend, while you fall under your walk your dog, if you have. Mine is right there. Sleeping. Do question, pause the video, test yourself, come back when you feel weak in an area and tell me. I always look on NCLEX website to see if it's anything updated. I think you don't need 10 different platforms. I didn't do it for my LVN. I stick with the books that they provided me and the platform. At that time, I think it's now needed to make a publicity. It was an ATI and was mandatory. So we bought all the books, everything. And practice, probably I did more than 5,000 questions practice. Now on the RN time, I have not ATI, I have Kaplan. So it's a little bit different. So now I have to kind of merge in that. And the teacher, one of the teacher says that Level Up, it's in YouTube, and also you can subscribe, says like it's very good. So there are two platforms. We have the Davies, so there are three. Why do I want boot camp? Why do I need this? Why, if already I have so much, I need to digest, I need to know these ones and to practice more in the question and understand the book. You need a study guide. So that's why I'm here. I'm your study buddy. And if you like, you can subscribe, share with your study buddy who is struggling or who might struggle. Let's change the way we study. Let's get you past the NCLEX with clarity, structure, and confidence. Thanks for watching. Comment your opinion. Stay grounded. Stay zen. And bye for now.